I'm going to talk a little bit about what's been happening with the Intelligence and Data Support or Decision Support Working Group over the last year. We have a lot of people participating. We haven't been as active as a collective, I think, as some of the other working groups. We've met twice in the last year. And I would say that what we have done focuses more on aligning work that people are already doing or initiating a few projects in small groups of the committee. But it has been, really helpful for us at the OCRC. But I want to say thanks to these folks. If you have, ideas or compliments, you can go to them. If you have complaints, just come to me. I won't put it on them. But thank you to these folks for participating over the last year. So our group was tasked with 2 specific activities from the action plan itself. The first was around obtaining or developing a plan to obtain occupational exposure data for the province. And the second was around using or developing and using existing exposure and disease surveillance information in a way that we could better inform system priorities and target prevention efforts and generate research questions, things like that. So 2 very broad and big activities. So we've attempted to move forward on both. The goal really in my mind here is to improve the data that we have on occupational exposure and disease in Ontario and improve or develop systems that allow us to support decision-making and prioritization in the province. So this is a sort of in progress or working work plan, I would say. We've come up, we started with scanning the relevant data sources that already exist, because you'll see in a couple slides that there are a lot of sources of data in the province. We also tried to summarize the ongoing activities that were relevant to what we were hoping to accomplish. And we're reviewing, we have some patch test information coming from Lynn's clinic. We have the ODSS system that Paul is leading and the burden report relevant to cancer. So pulling all this information together, we've thought about a couple of new initiatives as well in terms of making existing data electronic. As most of you know, we have a lot of exposure data here that isn't electronic. It's very difficult to access. It's hard to use when it's in paper form, obviously. So thinking about what we can develop, what we can harness that we already have in order to make it easier for people to use. And we've also looked at setting up a more formal, more permanent occupational disease surveillance system at Cancer Care Ontario. So we're pursuing that sort of a collaboration between CCO and the MOL and the MOHLTC. So that's an ongoing piece of work that we're working on. And what we're hoping to do is pull things together in the next month or so to have a conversation about the priorities for ODAP generally and how our group can inform revisiting those priorities, maybe making recommendations about what needs to be added or perhaps taken away, and thinking about the structure of our group in general going forward. So in terms of the data sources, I won't spend a lot of time on this because I know we're a little bit behind already, but this just gives you an idea of the data sources we have in terms of exposure here. So we have existing electronic exposure databases for Ontario. There's a national database at UBC that includes Ontario data. There is other tools that exist. So Mike Russo was telling us yesterday about a tool from BC that's relevant to construction. There's a lot of things. Some are industry specific, some are very broad in their focus, and some of them are publicly available. We're thinking for environmental sources of data, things that have been discussed include the Toxics Reduction Act, which for certain chemicals above a specific threshold requires reporting of usage in tons. So thinking about how we can incorporate these traditionally non-occupational sources of data to help us understand what is being used and where. And on the disease side, we actually have quite a bit of data. Many people will be familiar with the administrative health data that's available at ISIS. We also hold a lot of that at Cancer Care Ontario. The claims data that the WSIB holds, as well as the clinical databases. What's missing from the population, so the claims data and the clinical database have really good information on occupation, but the population level databases don't, and that's what systems like the occupational disease surveillance system fix in a way. They bridge those 2 pieces of information so that we can combine information on occupation with information on disease, and so that's what's really promising about these new systems. And this is sort of the main ones of what's going on currently, and there's already been summarized really in the data sources. So we at OCRC and CREOD specifically have lots of ongoing projects that are attempting to look at trends or monitor trends in exposure and disease across Ontario. So the themes, I think, that have come out of the discussions we've had as a group, but also in small group discussions over the year, are really that tracking of occupational exposure and disease is very important. It informs prevention, it informs primary prevention, secondary prevention, tertiary prevention, and that we do have a lot of assets, data assets here in Ontario, but we're not really utilizing them fully at this point in time. And we don't really have the infrastructure to do so right now. So a lot of the work that's ongoing is really project-based. It's funded as research, and that doesn't really lend itself to long-term sustainable surveillance. We think about surveillance as being ongoing, continuous, timely reporting to decision makers, and the project-based model really is not amenable to that sort of information flow. And I think the other thing we've talked a lot about, which won't be surprising to anyone here, is that really occupational disease is on the agenda at the moment in the province, and that we have an opportunity to take some big steps forward. And I think our group really wants to take full advantage of that as best we can. So that's something that we are always thinking about. So we have put a request in for some occupational disease claims data from the WSIB. So the next steps for our group really are looking at that claims data and looking at trends over the last 10 years in the claims data, and then compiling that with information from the burden report that Paul talked about, from the occupational disease surveillance system that has results coming out now, and from the patch testing database, and thinking about priorities, both on a disease perspective, on an exposure perspective, and then also thinking about what are some other potential projects that this committee could undertake, or organizations participating in this committee could undertake. And this includes things like digitization of existing data. So can we get money to support organizations creating their own electronic databases that may be of use to them, but also more broadly to the system? Can we incorporate environmental data into our occupational disease systems? Developing this program of occupational disease surveillance for the province. And we continue to sort of advocate in our meetings around the addition of the occupation and industry to EMR, because that would get us closer to where we want to be. It would give us information on the population as a whole rather than just groups of the population. So we are hoping to meet in the next month to do some more discussions and prioritizations so that we can report back to the implementation team broadly about priorities going forward for year 2 of the action plan itself. So I'll stop there.